So, hello everyone. My name is Dr. Rajeev Sivasankar. I'm the Director of Neurointerventional Services at Fortis Hospital, Mulund in Mumbai. And today I'm here to discuss something which is been on the forefront of every leading health magazine, health newsletter, etc. And that is acute stroke and how modern day advances in interventional neuroradiology have been making giant strides in making sure that patients who get affected by this deadly condition can go home with uh, good outcomes. So let's start this off with a basic foundation in understanding what do we mean by this word stroke. So I have lots of friends who confuse a heart attack and a stroke. So, to put it in very simple terms, a stroke is like we can make it analogous to a brain attack. So, just like somebody knows that if there is less blood supply to the heart, they call it a heart attack. Similarly, if there is a disruption of blood flow to the brain, that we can call a brain attack or an acute stroke. Now, this disruption, unlike the heart, in the brain, this disruption of blood flow can occur in one of two ways. They can either be a blockage or they can be a bleed. So, in case this disruption is because of a bleed, it is termed as a hemorrhagic stroke because it is hemorrhaged or bled. And in case it is due to a blockage, it is termed as an ischemic stroke. Now, almost 80 to 85% of strokes where there is a disruption in this blood flow are due to blockages or ischemic in nature, and about 15% are due to a bleed. So let's quickly see what the conditions are which cause this majority of these blockages, and why should someone get a blockage. So just like multiple other diseases, the factors which underlie the causation of this stroke would be the same, that is diabetes, hypertension, cigarette smoking, nicotine abuse, stress, uh, and what there are familial conditions, or there are conditions like dyslipidemia or other familial conditions which can predispose someone to having a stroke. Now, uh, sometimes you have modifiable conditions like obesity, eating junk food, lack of exercise, a sedentary lifestyle, avoiding smoking. All these are under control, so we call these modifiable risk factors. And some we really don't have control over. For example, a person may be a diabetic despite being otherwise having a healthy lifestyle and exercising. That's because he's genetically predisposed to getting diabetes or hypertension, so he does not have a real control. So these are non-modifiable, but they have to be controlled by medications so that those risk factors like sugars going out of control, etc., get within normal limits and do not cause target organ damage to the vessels. Now, the other kind, what happens when these risk factors affect the blood vessels is that they can either cause a buildup of a little cholesterol plaque, and that cholesterol rich plaque, a piece of it can fly up from either the neck or the arteries, or can even build up within the brain arteries itself. And if it flies up, it's called an embolus, and that can cause a blockage. Or primarily, the plaque buildup can occur within the vessels of the brain, which is called intracranial atherosclerotic disease, which is another cause of that blockage. A large chunk, which varies from continent to continent, the percentage of it, can come from the heart. So, since it comes from the heart, these are called cardioembolic in nature. And these can occur if there are some rhythm abnormalities in the heart, like atrial fibrillation, or there are other underlying valvular conditions in the heart which can predispose to a piece of vegetation or a clot flying up into the circulation within the brain and causing a stroke. Now, coming to that 15% subset of hemorrhagic stroke, or the conditions in which there's a bleed in the brain. Now trauma is the commonest cause of bleed in the brain. Somebody has a fall or someone has had a road traffic accident. That is the commonest cause of a bleed in the brain. But in the non-traumatic subset, somebody who's not had an injury, why would he or she have a bleed in the brain? And one of the commonest underlying conditions for this would be hypertension, in which there is a hypertensive bleed in the brain, because some amount of effect of that pressure, that high uncontrolled blood pressure, is exerted on the end arterioles, which rupture and thereby cause a bleed. There are other underlying conditions like a ballooning of the arteries, which is called a cerebral aneurysm, a vascular malformation, which we call an arteriovenous malformation or an AVM, or a dural AVF. These are conditions which can cause a bleed in the brain. Uh, Now, how does someone know that their family member or their friend or someone in their circle or they themselves are suffering from a stroke? Now, see, stroke is an acute event, means it occurs suddenly. So, if suddenly someone uh, feels that they are losing power or they've lost the ability or the strength in their upper or lower limbs, in their hands or their legs, or they find that suddenly that one half of their face is not working as well as the other half, it droops, or you feel that there is a loss of balance, a difficulty in seeing, or there could be a slurring of the speech. A combination of these or a singular event also, we can use the acronym B FAST, that is balance, eyes, face, arm, speech. All these we have to, within a finite time window, reach a stroke ready center. So, how does one know if they have a stroke? If somebody suddenly develops these symptoms of loss of power within their hands, or then not able to grip something, or the slippers are slipping out of, they're not able to grip the slippers, or the speech starts slurring, or they lose the balance and suddenly feel things are spinning around, that's the time that we need to suspect an acute stroke. Now, Shuren is a big problem because we know that it's very popular. Even in movies, it's popularized that someone clutches their chest and it's chest pain, and they have to go to a heart specialist or cardiologist to address that. But when somebody loses the ability or the strength, a lot of time is wasted in making that person lie down, giving them water, massaging that limb for hours, and saying, go to sleep, when you wake up, it'll be better. And there's where we lose a lot of crucial time in saving that brain. Which brings us to that question, that what happens to the brain when you take away its blood supply? Now, like we know, every living cell needs oxygen and nutrients to survive. Similarly, the brain cells also need the same thing. If you take away that, they are going to die. And if they die, the part of the body they control will also lose function, which is why we need to make sure that this ability of that brain to function or control function of that body part is not lost. So, what are the means by which we can treat these blockages? So, when if someone has an acute stroke, the first thing when they come to a hospital is they get imaged, they get stabilized, and they get imaged, which means someone looks at the fact that they're able to breathe properly, and then their BP is okay, the sugar is not too low, and then they go straight for imaging, either a CT scan or an MRI, after which we decide that yes, this is a blockage which is causing a stroke, and that also that imaging gives us the information that how much of the brain can we save. Now, once we have all this is done very rapidly within like 10 minutes to 20 minutes of reaching a hospital. So in 10 minutes we have all this information, and once we have that, if a person comes within 4.5 hours of having that stroke, we can give a medicine to bust that clot, to break that clot, and that is called an IV thrombolytic. Now, many a time patients, either they have a very large clot, in which case this medicine doesn't work as efficaciously, or they come beyond this 4.5 hour window period, in which case neurointerventionists like myself, what we do is that we put devices into that blocked artery in the brain and we pull out that clot. Now, uh, the way to do it is extremely simple. It's done by the angiography route, where you thread a small little tube into the artery which is blocked. You deploy either a mesh like tube called a stent, which has got a tail to it, so it's called a stent retriever, and then we pull out that clot, or you can put in a little bigger catheter in and suck out that clot, which is called aspiration. Now, this is highly efficacious, highly successful treatment. So technically, we can open out 9 out of 10 such blocked arteries with modern day hardware. And clinically, now here's the important part. Technically, getting that flow back is great. But we want a patient who's got paralyzed, a patient who's lost consciousness, whose very life is at risk, to walk out home to be healthy. For this very reason, we need someone to get this treatment very early, because every second, 32,000 neurons die. When somebody has a completed stroke, they lose 1.2 billion neurons. So, the aim of the game is to be extremely quick in getting that offending blockage or that clot out of that person's system, so that the brain gets all the perfusion that it deserves and gets back to being healthy. So this is in a nutshell, is the advance that had occurred since the past about 12 years now. We've been, these first trials came in, which were very strongly recommending that this treatment is very good for patients and makes a huge difference. So these come into something that we call as level 1A evidence, which is the best of the best evidence in proving that this treatment really works and is very strong and effective. So this is about the treatment part. A lot of time, many a times I'm asked the question that, is this very risky? No, not at all. It's not very risky. In fact, if you look at the risk versus a benefit ratio, it's highly in favor of the benefit. Not doing it is much worse for a patient. Of course, every procedure, every operation has its own risk, and the risk of having intra-procedural complication does exist. But notwithstanding that, if you want to generalize it in generic terms, it is quite a safe procedure. The question which also arises is that a lot of people say that, number of strokes have increased in the younger population, and that is true. We are seeing a lot of strokes in people in their 20s, in their 30s, in their 40s. And earlier we used to think that stroke only occurs in the elderly, those who are 60, 70, 80. But is that a myth? I don't know. But the reality of today is that we are seeing patients who are in their 20s and 30s and with large vessel occlusions. So why is this occurring? Of course, a lot of pundits who are better versed than I am in the preventive aspects of health say that the amount of obesity is an epidemic in the country. So the amount of obesity has increased, which is directly linked to lifestyle diseases, which has increased the risk of stroke. Another thing which a few psychiatrist friends of mine say is that the amount of time which is sucked out because of screen time, because of the use of mobiles, etc., has made us very sedentary, and that also compounds the effect. Now, there is also a theory that, in addition to people being very busy and stressful, leading stressful lives, there's a lack of sleep. And lack of sleep by itself is a huge, huge risk factor in causation of stroke. Now, I really don't know if there are any, you know, way to prove that, but definitely this is a theory from some of my psychiatrist friends. So, in the end, if you sum up the ways to reduce the risk of stroke, or even a heart attack, or just staying healthy, it all comes down to or boils down to those common risk factors of eating healthy, exercising well, not having any substance abuse, sleeping on time, sleeping enough, and leading a stress free life. So, that by itself will greatly reduce the chances of having this brain attack and keeping the arteries of the brain very healthy. So, this was my very brief introduction for today about this deadly disease. It is the second most common cause in the world for mortality and morbidity. Every 6 seconds, someone dies of a stroke. So, I repeat, make sure that anyone that we know or within our family circle or friend circle gets the attention. We should popularize this and make sure stroke awareness goes out into the community so that everybody receives appropriate treatment, which we offer in advanced stroke ready centers. And this is the it's a movement that is required by the country to make sure that this deadly disease does not kill or maim. Thank you very much.